Welcome back to that episode here on the Hart podcast. Our guest today, she was actually on track to become a doctor. Now she's reimagining dementia, care for an entire generation. And what changed and what did she feel at that moment? We'll actually have to figure that out. But let's get into it. Maley, welcome.
Thank you, Efrain. Glad to be here.
Same. So let's kind of get straight into the conversation. We only got but so much time. You had a plan, med school, the white coat, the whole thing.
Yep.
What did it feel like emotionally to just walk away from that version of your future? Like, I'm pretty sure now you're like, I'm happy I did it. But in the moment, it was probably a little crazy.
Absolutely. I definitely made the right choice in the end, but I think our lives are filled with these inflection points. And growing up and starting out in life, your perception on healthcare are the providers that you experience when you need healthcare, whether it's the tremendous nurses or physicians or techs that you're meeting when you go to receive healthcare. And so I knew I wanted to help people. I loved science and math. I wanted to get into that field. Uh, Came in my first year of college and realized, there are a lot more roles in healthcare, and being a physician isn't the only way to support people. And there's a lot of impact that you can have from a public health standpoint. And so I was kind of in the right place at the right time. I went to GW down in DC. I loved that university, and they had a tremendous public health program and sociology program. And so when I fell into that track and was able to combine those two instances, they've continued to intersect throughout my career. And I really started to look at healthcare as human development and see how we can combine those two lenses throughout all the work that I do.
I love how life could, I always say the word life be lifing, but that's what it is. You go to school, you're there for one thing, realize, well, maybe I can actually pivot this and
Things
still be in the
change.
same realm of things. You know what I mean?
Absolutely.
Um, hell, I used to always kind of pray to God or tell people that one day I'm going to be on a stage talking to people. And this is my stage that I'm blessed with, right? Talking to people. Like, this
Absolutely.
is great. So I believe that when you have this vision, we think of it one way, but life just takes us down a different route. And now you're sitting as the president, is that correct, of the organization?
I'm the chief operating officer here at LiveWell up in Connecticut.
Did
So.
you ever think COO was the title that you were going to go for one day?
It surprised me myself, and I started as an intern at one of the largest health systems in Connecticut and got some really fabulous experience from some amazing leaders very early on in my career. I find that there are so many executives and leaders that are just hungry to share their knowledge. And if you show up in the right place and come with curiosity and a willingness to help and basically do anything that people need help with in senior living, that's really unique because we are a place where people live. And so it could mean helping in the kitchen one day, it could mean helping with housekeeping one day, but you put that time in with those different teams and people see the sweat equity that you're putting in and your willingness to learn every level of an organization. And then that can translate to being at the table and getting to observe other senior leaders. And so I grew up quickly at the health system that I was at. And then we had this little thing called COVID, which I think many of us want to move on from. But I was a licensed nursing home administrator in 2020, and I hadn't practiced yet. Um, Nursing home administrators decided that was a great time to retire because of all the stress that the pandemic put on. And so for a lot of people, it left some openings. And so I seized an opportunity when the phone call came to be the chief operating officer here at LiveWell. I was very fortunate. They actually called me the day after I had a COVID elopement, which was very popular that year. And they said, "What are you up to?" And I said, "I got married yesterday." They're like, "You want to have an interview?" I'm like, sure. Why not just make lots of really big life changes in a short period of time?
I'm happy that, I mean, the pandemic was definitely not a beautiful thing for a lot of people, but
Definitely not.
there was also so much like positive that happened in people's lives, right? Because there was so much risk that had to be taken, and people really taking the time to find themselves in a sense as well. And now when I have these conversations and I say, "How did you get here?" People will say 2020, everything changed for me. And it's like, wow, like, yeah, there was a lot of bad things that happened, but also so much changes and so much success that happened in people's lives during that time. But I want to talk about the leadership. You mentioned that on your journey, you met a lot of good leaders. They're always willing to share information. I believe that sometimes people are afraid to speak to leaders,
Mm.
right? But if you ask the right question, just ask the question, they're always willing to give you insight. What are some of the things that you learned early on as you're kind of going through trying to get into the leader C-suite space? Do you remember anything like maybe that leader that gave you some good information that you still hold on to today?
I think one of the things that I hold on to the most is when you are at a table where you absolutely know, and this is me every day, I am not the smartest person in the room. I
Yeah.
am here to learn from the other people at the table. And so if you can sit there and you can gain that information and know when to ask a question and when to maybe pause and ask the person after the meeting happens or after the board meeting, there's a time and a place. And if you can time your questions correctly with great leaders, they will absolutely share candidly what you want to know. I also think it's finding really authentic people that are there because they want to be and they're optimistic and they have views about their career that are ever evolving, and they just as much want to learn from you
Hmm.
as a younger professional or as a student as you want to learn from them. And when you find those couplings, the synergy can be just quite tremendous. If you find somebody who's stuck in their ways, you can sometimes get that sense. Don't keep trying. Turn around, because
Yeah.
there's probably somebody else near them that can get you the experience and the learnings that you want to have from them.
Those are always good. I haven't been in a space where I had to lead too many young folks. But when I was in management and I had to lead those young people that never had a job and just, I love those because you really get to mold them into what it looks like to be just a great leader. Because to me, I was always training leaders up. But yeah, you definitely do notice when someone comes up and they're more just chasing a paycheck and not really the purpose. And in your case, purpose is everything, right? In this job, do you agree?
I think purpose is penultimate when you're thinking of nonprofit, senior living. We work with people with cognitive change and dementia, and it can be challenging work. And there are a lot of regulatory challenges, there are a lot of stigmas around our field. And so for young people, the idea of saying, I want to work in a nursing home, that often is faced with why, or that's hard. Isn't everyone's job hard? Doesn't everybody have a purpose? And
Life is
so
hard.
life is hard, but it's amazing how you can be greeted when you share what you do, and especially as a young leader in my first management type position, every single person that reported to me was at least 15 years older than me. And so that was a really interesting dynamic to be sitting in a team meeting where you're the youngest person and you're the supervisor. You have to listen. You have
Yep.
to be open to what people have on their plates inside and outside of work, because I don't have the experiences that they have. I don't have the life road that they've had to where they're at. So how can you respect each other, try to see where other people are coming from? And one of our things that we say a lot here that I've really embraced myself is practice being human, because we're
Mhm.
all human and we all experience
100%.
this range of emotions and challenges on any given day.
I want to talk about what you said because for those young leaders that are going to experience the same thing, you're in a room with people 15 years older than you. It is not easy, right? I feel like it's intimidating as hell. They're already looking at you like, who is this young individual that may not know anything, but you still got to show up with confidence and know that you don't know everything in the room. You mentioned it. I'm not the smartest person in the room, but I'm here to learn. And I want to grow, like pour into me. And I just remember being in some rooms sometimes where I had those people would just almost say things to me just to try to see what my reaction would be. Right? Like it was just the
Little
worst
test.
thing ever. Yeah.
Yeah.
And I was young. So, sometimes you tested the right person. But I speak to those people. What are some of the things that you had to carry on being in those rooms when you are the youngest person in the room? Because it does happen more than often nowadays.
I've definitely learned and grown since that time. I think when I first started, I felt like I needed to do things that almost postured me as older or as more experienced or less goofy, or just hiding certain parts of my personality to show up as the person that I think they were expecting the leader to be. And so it took me pretty much until I came to LiveWell to really embrace my authenticity as a leader and what I could bring to that table. And so when you're sitting there and you're trying to present as more serious, more put together than other people, there's always a gap between you and the people that you're leading, or you and your supervisor. And so I think the faster that we can recognize that if we're there for the right reasons and we're there for the mission of the organization, particularly in nonprofits, then we have something really cool in common already. And so how
Yeah.
can we use that to guide our relationships and break down some of those barriers on, I have kids that are older than you, or I'm not doing anything new, I'm retiring in 4 years, I'm not changing for you, good luck. And
Yeah.
then kind of chipping away at those people with your tenacity to know they're saying that, but if they're at a mission-driven organization, particularly senior living, nonprofits, they're not just there for a paycheck. There's more to it. And so you just be tenacious, be persistent, and have grace that this is a big change for them too, and they may not be in the spot that they thought they would be in their career.
Yeah, I had this experience. I was like 19, 20 years old, where this guy was like probably in his 50s, and he happened to be the friend of the supervisor. So maybe he was supposed to be a store manager, just maybe didn't fit for him. But I happened to be the store manager, so they put him to work with me, and the guy would not work with me, and he flat out told me, Ephraim, I think you're great. I think you're a great leader. I think with the right team, you'll be amazing. I just can't work for you. And it was, you're looking at a 20-year-old, and I get it. You're looking at a 20-year-old guy, right? Kid, I'm 20 years old. I'm a kid.
Lots of
Uh,
energy.
yeah,
Trying to
lots of
prove
energy.
themselves, yeah.
Exactly. He just wasn't with it. And great guy. I loved him. And I respected that. And I'll never forget that he said that to me. Ephraim, you're great. And with a great team, you'll be phenomenal. I just couldn't do it. And at first, I felt some type of way, but it happens every single time. And we just have to also be patient, because sometimes we have to go through that and almost prove ourselves that we're not here, as we mentioned, for a paycheck, that we're truly here because we love what we do and we want to be better. Like, I'm willing to listen. I'm willing to learn from you. And that's what kind of leaders we are. It looks like, Maley, you're the same leader. It's like, hey, I don't forget where I come from. Yeah, I'm a COO, but I'm still on the front line. And in the nonprofit world, you play you have every hat on,
Okay,
actually.
lots of hats.
Yeah. You're not just COO. You're doing a lot more things. But no, this is exciting. I also want to talk about, you mentioned that your organization deals with dementia. And you're really flipping the script on how even we talk about dementia. Like, what does that look like from the organization standpoint, from Maley's standpoint?
Yeah. So LiveWell's a really unique place. It's been around for over 30 years. We started as the Alzheimer's Resource Center. So in that, we shared very broadly what we do. And through the last 30 years and plus, this organization has evolved to continue to change based on the voice of people with the lived experience. And so what that means is we're crafting our vision, we're crafting our values, we're crafting our mission, our programs by including the voice of people living with dementia and finding what are their strengths, not what are their deficits, not what are they losing. When we think of dementia care, people often refer to it as memory care. Memory care calls out what you might not have. And so how can we start to flip that script at LiveWell? If you go on our website, you look up anything about us, you'll see why we're different than memory care, but you'll never see us define ourselves as that. And I think later we can talk about some of the challenges that come up with that, but I think it's just this piece of using a strengths-based lens and recognizing, coming back to that piece, we're human. Your diagnosis doesn't define you, and there's a human development piece and a disability approach that we can take with people living with dementia that is not the commonplace right now.
You know, I actually just heard, and I don't know if you guys experience this or do this, but that there's some VR or there's like something that you can put on that it allows you to experience what dementia actually looks like. Have you experienced that or heard of something like that?
So we haven't used VR, but we are actually the lead dementia-friendly educator for the state of Connecticut. And
Okay.
so we do a lot of experiential trainings with people. We call it dementia-capable care. And it focuses on meeting people where they're at. And we use tools like glasses or gloves or different things so that people can experience the sensory defects that might come along with a changing brain. I may not be able to see from my peripheral vision. I may have blind spots. I may not have the dexterity in my fingers. And while those are things that people with dementia experience, those are also things that people who age experience.
Yeah.
And one thing we all have in common from when we are born to when we die is that we are aging. We're all going
Yeah.
to be 30 minutes older when we finish this podcast. We're all aging, and so how can we kind of share in that experience through the education and the learning that we have about different diagnoses that can happen as we get older?
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure you guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. Which is really why last time I spoke to you, you said the focus model is really um, on strength, not
Strengths.
Loss,
Yes.
right?
Strengths.
What have you witnessed in someone's comeback story that made you stop and go, "This is why we're doing it this way"?
I think there are a lot of them. We have an empowering partnership network that is made up of people living with cognitive change and dementia, and they are the spokespeople for this movement, because it is a movement to see people beyond their diagnosis. And we had a panel a couple months ago where people got to share what their experiences, and they always start the panel by saying, "What are adjectives that you would use if somebody used the word dementia?" And they go around the room and they have people share things, and it's hopeless, it's despair, loneliness, not able to do things, not independent. All of these negative adjectives come up. And then through this panel of 3 or 4 people sharing their story and their experience of a diagnosis where somebody gave them a diagnosis of dementia, they're there with a loved one, immediately they start talking to the other person as opposed to the person that was just diagnosed. They're like, "I'm the same person I was 5 seconds ago before you did the test. Why are you not looking and talking to me?" And there's unfortunately too many stories like that. But then through this sharing of these lived experiences, at the end, they ask the same question about the adjectives. And you would be amazed at the things that people share and the ability to learn, to grow, purpose, hope, tenacity, and all of these things that people share. It's amazing to watch a room evolve in 45 minutes. And it's because people living with dementia are sharing their story. And so that's probably one of the most powerful things that I've gotten to experience since being at LiveWell.
I was going to ask you, on your hardest days, what really pulls you back, even when you're frustrated, tired. But this is it, is hearing these stories. I can only imagine. Is that correct?
It's
This is what fills your
these
cup?
stories, and then it's the team, because the people we work with they're here for the mission. They want to grow and evolve. And you talk about CNAs, nurses, people who are working 24/7. We have all types of supports here, and they love what they do. And they take the time to get to know people, get to know their strengths, get to know their histories. They know more about the people that live here, sometimes than their kids or their families, and the stories that they have. You can just walk around and you can feel it.
I love stories. Every time stories is everything. When we share stories and tell those stories, it truly does make an impact. So you mentioned stories. I do appreciate that. I want to get into the technology piece because in elderly care, we did mention VR. I know you said you weren't in that space, but we have to continue to adapt. And I know when we say the word AI, the elders are kind of probably living in fear a little bit, right? How do you continue to add that in there, but never lose humanity? Because I think that's where people are thinking is like, we're going to lose the human touch. And I'm not a believer in it. I think it just helps us really do things at a higher scale if done right. There is those that could be used in the wrong. But how do you allow that to help in a sense of never using humanity, but still help the mission?
So I think some of the best ways that we're using technology is through, there's this wearable tech we use called Care Predict, and there are these infrared beacons all over our campus. And this software uses AI to get to know the person who's wearing the wearable, just like if you have other smartwatches and things like that. And so when we installed this technology, we use it for autonomy. Because when you think of traditional memory care, you think of locked doors, you think of people focusing on safety and security, not focusing on autonomy and choice. And so what Care Predict allows the people that live at LiveWell or the community members that are here having classes, it allows them the ability to unlock doors to their apartment, to their balcony, to the outside. It also tracks their sleep patterns and their steps, and it just gives them like a key to the campus. It can even track and predict things like social isolation based on we're friends, and then it notices, you know what, we haven't been spending as much time together. We get an alert saying Maley and Efrain are no longer talking to each other. What's up? Maybe they're not socializing. Maybe they're feeling depressed or reclusive. And so it's starting to give us insights into how people are doing. And so it was a really big investment of time, resources, and shifting how people think. And people said, nobody's going to wear that. Nobody's going to want to wear a wearable on their wrist.
Mm-hmm.
Every single person has wanted to wear it. We haven't had one instance of somebody not wanting to wear it, because the why is autonomy. The why is choice. And it's normal now to have a smartwatch that tracks what you do. And so I have dementia. It's normal to have this wearable because everybody that works here has them. Everybody that lives here has them. It can pay for your lunch at the cafe. It's a tool. We all use tools every day. And I've been telling my boss, I said, like ChatGPT, I put some things through there. It's a tool. You drove to work in a car. That was a tool. Somebody a long time ago said, no, you can't have a car. It's got to be a horse. This is that. This is that equivalent. And yes, I did say that to our CEO last week.
You got to put it in that sense sometimes, though, like really for them to understand. I love that you mentioned that, because it is so hard sometimes to get something to the other side because of that, right? Like, who's going to wear it? No one's ever going to wear it. And then you're in a space where everybody's wearing it. And I know it makes you feel good, like, I knew I was right if you would just listen and not fight me, because we always go through that situation because people live in fear, or they don't know. They're just not educated enough really in that space. And that's why a leader like yourself.
Take the risk. Try, fail,
risk.
try again. And I think that's something that when I talk to great leaders and people like you, there's a pattern of take the risk, try. What's the worst that's going to happen? And it's
Where does that come from, though?
The worst is probably not actually the worst that does happen.
Where does that stem from? Or being a risk taker?
I think it comes from my upbringing and just seeing some strong parents and role models in my life. And I've been very fortunate to have a good support system and my brother and things like that. But you only get one life. And when you work in senior care from the age of 20, you see people who say, I wish I did the thing.
Yeah.
I don't want to get to 60, 70, 80 saying, I wish I did the thing. So I encourage all of us, because now's the time, not tomorrow.
I love it. I love that I heard the same thing when I was, I think 23 is when I opened up my first cafe downtown Orlando, and after a year I had to close it, right? And I'm here trying to find angel investors because I wanted to keep it open. I didn't want like a failure. And when I spoke to my mentor that was 10 years older than me, he said, why do you want to keep it open? And I said, well, I don't want to I failed. And he's like, you took a risk and now you can learn from it. It's not a loss, it's a lesson. And he's mentioned exactly what you said. There's people 30, 40 years old saying, I wish I would have. You did it. Now you don't have to live with regret. And I think life is like that. It is roller coasters. There is ups and downs. And I think sometimes when we get so uncomfortable, because sometimes we're super comfortable in what we're doing on a day to day, and when we get uncomfortable, the doors start to open, and life just starts to happen in ways that we've never experienced. I mean, look what happened to Maley when she took a risk and shifted her damn career. And look what she's sitting as COO. It probably doesn't happen if you were on the other side of life, right? So yeah,
well, it's like what you said with COVID. We didn't have a choice but to change. Yeah. Everybody in the world had to change something, generally speaking. And that's when you talk about, you hear lots of cool things and beautiful things that happened during that time. when you put the pressure on something, that's when the change happens.
Yeah. And I think when you talk about pandemic, it's because that mental health, right? Everybody started to tap into their mental and see things a little bit different. I love that mental health has actually become a word that we can use so freely without being judged now. Because it was when we talked about mental health, it was something that people would judge on. Now it's the same conversation. We're getting older. I'm 35 and I think I hit midlife crisis or something because I was turning 35. I was like, oh my God, I started thinking about, death. And I started thinking about my kids or if I'm not here. But we're all going to go through it. And it's a conversation that we should be having. And Maley, you've been in this conversation for a lot of years now. I don't know the age, but since you were 20, so I'm going to give you like 10 years, okay? 10, 15 years, okay? I ain't going to disrespect here. But
Yeah.
I love that you're in this space. Is there anything like that one piece, traditional dementia care you refuse to bring into like LiveWell's future?
I think one piece that we refuse to acquiesce on that I see as a challenge for us, but also our biggest asset is language and the words that we choose to use. We are very intentional in our language because when you think of traditional dementia care, memory care, it's not strength based. It's very paternalistic. And even some of the communities that I get to tour that do it really well and they mean well, their purpose, their mission, it's so aligned. There's still this paternalistic thread that goes through of doing for versus doing with, or seeing what I need to help someone with, as opposed to saying, what's the most important thing for you in a day? Let's spend your energy on that, and then let me support you with the other pieces, as opposed to me deciding what's important for you in a day. And so I think that language is something that LiveWell really prides itself on, and it sometimes has us ending up as the best kept secret, or something people say. I had a tour last night and they said, I wish I knew about this sooner. Like we've been saying it this way since 2017 when we rebranded as LiveWell, because people didn't want to get on a bus that said Alzheimer's Resource Center. They wanted to live well with dementia, and they wanted to live well in their life. And so I think it's just this piece of language, and that doesn't take resources. Each person that's listening to us today, whether it's you or me or the people I'm going to talk to later today, is just this idea of you are one person, but you can choose how you speak about any cause, whether it's dementia or anything that's meaningful to you. How one person shares something can make somebody else say, maybe I can change the word that I use or the phrases or the terminology. And I think of like how people delineate gender now, and we share our pronouns so much more regularly. What's the equivalent of that for all these other movements? And that's kind of that sociology lens of, well, what is the antithesis of stigma? How are we looking at other causes and then connecting the dots and learning from them?
Have you ever done podcasts before?
I did one podcast before.
You're so good at this. I'm just listening to you. And I'm like, when Maley goes back and sees this, the mic, everything, like she's going to be doing her own podcast soon. I'm just saying,
Gosh.
you're just giving us,
Well, you're
you're giving
helping
us
with
the
the
good tips.
content. That's so hard.
No, I love it. Live Well, you said you guys changed the name. Is this something that's local? Because I feel like I've heard Live Well. Is it just local, or is it something that you guys actually are international?
So we're a standalone nonprofit. We do have reach through consulting engagements across the United States, and we've partnered with some people internationally as well. But we're trying to get the word out there, and we're growing our online database of courses, and we have virtual classes. But we started as a nursing home and have continued to evolve from there, because I think most of us would agree that while our goal would never want to be to live in a nursing home, what are other things that we can do that could help prevent pieces of the aging process or prevent dementia? There are modifiable risk factors that you and I can start doing today that would have significant impact on our ability to have a healthy brain for the rest of our life. And so LiveWell is trying to tap into those pieces and partner locally and globally on building those resources in the United States.
What an idea. You said, let's not just stay in this box. Let's really expand out of it. I think it's genius. Was this your idea? Whose idea was it?
So I started at LiveWell 5 years ago, and this train was already going before I got here. And so our CEO, Michael Smith, is a tremendous visionary. He does a wonderful job of, like I said earlier, including people with that lived experience. And so whenever we're making decisions, it's a team approach. It's including people who have had the experience. I, at this point in my life, don't have a changing brain. And so I don't know better than the people that I serve who do have that diagnosis. And the second that we think that we do know better than someone who's actually living the experience is when we'll probably start down the wrong path. So through Michael's leadership and collecting really dynamic leaders along the way and tapping into the residents here, people in the community, and then recognizing the United States is one country. There are a lot of things happening in Scotland, in Finland, in Korea, that we can bring those practices back here and collaborate on.
And you said some of the courses. What are some of the courses that you guys offer online so the people that are listening can know?
Absolutely. So we have some synchronous classes, and so we offer virtual fitness classes, virtual cognitive stimulation therapy classes. We have support groups, but then we also have a healthy lifestyle program that can be done online. And then hopefully we've applied for some funding to continue to expand that library and offer some of the full series that we're doing on campus as asynchronous learning. Because when I think of people like my parents that want to consume what we have to offer but can't come here every Thursday for 2 or 3 hours, what do we have to offer? And so hopefully with this funding, we'll be able to create some really dynamic videos that can be offered further afield.
This is very dope. And you said you've been there only 5 years. So what is the next 5 years at LiveWell? What does success look like in the next 5 years for LiveWell? I mean, you spent 5 years. I can imagine another 5 years with you and the CEO and great leaders. That there's a lot more to come. You mentioned a little bit about on the programs and expanding that. But is there anything that you, Maley, want to actually see that maybe you're fighting for?
I think the thing that I most want to fight for LiveWell is to continue to grow in becoming a household name in concert with the mission and the movement that we're trying to create. I have gone to places all across the United States that are exceptionally proud of the work that they're doing, and I'm proud of the work that they're doing. And a lot of it are things that LiveWell might have been doing 10 years ago. And so how can I help take what we do in Connecticut and influence other senior living leaders in this field and not in this field across the United States? Because if we can start to change people's language, not just at LiveWell and further out, and recognize and not hold too tightly the fact that we're a residential provider, because I think this value proposition for senior living leaders is, I have all these apartments or I have all these beds. They need to be full. That's how I get my revenue. That's how I reinvest in my mission. And I just want to challenge people to say, you can go upstream. You can become part of the public health solution to figure out, how do we grow healthier brains? How do we have classes? How do we target people who are younger and not ready to move in so that if they ever don't want to live at home, maybe they do live here, and it becomes more of a choice proposition as opposed to a necessity proposition. And I really think that in the next 5 years, LiveWell is poised to do that through some of the partnerships with local universities and researchers that we're starting to form today.
You guys are doing it, man. You keep talking to the people. I'm actually going to ask you, for someone who's listening but who's scared to lead with heart in the data-driven world, like a nonprofit, what would you tell them from the other side?
I mentioned it a little bit earlier, but I think it's authenticity. I think when I shed the notion that I needed to be something other than myself, that was when I really unlocked my leadership. I am someone who cares very deeply about my work. I work very hard. I am very committed to this. I really eat, sleep, and breathe the work that we do here. And I do it in a fun way, and I goof around with my team. And last week I was in a dunk tank for our education fair. And I think it's just kind of doing all of these different things that are relatable to people, because if you think you need to lead with a certain way that's different than how you live your life outside of work, you're always going to be pulled in this tension and this dichotomy that takes energy. And so I don't want to use any of my energy putting up a facade and trying to be someone that I'm not. I want to use it to do the mission and to connect with the people that I work with and to support well-being. In our mission and our vision and my personal philosophy, we spend a lot of time at work. If I can't
Hmm.
see you as a person and say, you know what, it looks like you're having a day where maybe being here isn't the right thing for you. Why don't you go to the beach? Take the
Yeah.
afternoon, because
Yeah.
tomorrow you'll come back better than if you had suffered through the afternoon and then you're not recharged for the next day, and then we've lost 2 days
Hmm.
progress versus just a couple hours. And so I think it's finding what those things are for each of your team members and knowing them on a level where the recognition is pointed enough to say, you know what, your bonus for this season that we're in is, why don't you take your spouse to that restaurant you've been wanting to go to because you work in the culinary department. We're going to call ahead. We're going to talk to the chef. You're going to get to tour their kitchen. That's better than giving someone $1,000. That's an
Yeah.
experience that they're not going to forget. And so I think finding that and learning that in your team is really how you can motivate them.
You're such a good leader. Like, yes, it's not about money. Sometimes it's just letting people feel seen or heard, right? You're a totally cool leader. I love the fun part about it because I'm the guy when I used to be in the corporate world that I'm coming with all the energy. And if you didn't have the energy, no worries. I got the energy for the both of us. Uh, so I used to be a facilitator, and there were some times where I would work with other facilitators, and it just wasn't the same, right? The energy was different. They just weren't fun. They were just too serious for me. And it's like, listen, we're here for work, okay? I get here for a job, but you don't got to lose yourself in it. Don't be fake. Be yourself authentically within still being within the guidelines of professional. So I always enjoyed that, man, because it allows people to really want to come to work.
Yeah,
You
it's
have less
balance.
call out when you as a leader show up like that, like show up and create the foundation and create that energy. I mean, I used to facilitate sometimes 7 o'clock in the morning, and at 6:45 I'm already blasting the music, and the other facilitators looking at me like, there's no way in hell, Ephraim, it is 6:45 a.m. And I'm like, we got to be up, we got to be, because you have to create that in your establishment. And mainly the whole time that I'm talking to you, I see why you're in the position that you're in. And one day you're running it as CEO. I'm going to put that out there because, we got to speak it into existence. We're going to start wrapping up. It's already, I mean, godly, almost 40 minutes in here. We didn't even realize it. But if people wanted to know more about Live Well, people wanted to connect more with Maley, what are the socials that we can go to?
Yes. So LiveWell CT is our Instagram, and it's the same link for Facebook. And our website is a wonderful resource and tool, and it's constantly changing with special events and ways to connect. You can actually join and become an advocate, become part of the movement. And so I think that I also invite anybody who is remotely near Connecticut to come in and visit. We love having people visit. Just stop in, and we'll get you a tour and connect you with some of the services that we have here. And then for me, you can definitely look me up on LinkedIn, Maley Hunt, and I would love to connect. I talk with students and leaders through my university, through our nonprofit association, Leading Age, and I try to find the time for everybody. The best tip I have for anybody who's trying to get in touch with a leader is just maybe remind us a few times, because there's a lot of things going on and we want to make the time, but give us grace if we need to reschedule once or twice.
Exactly. I actually had someone that was so unhappy with me yesterday and wrote me an email and says, this is very unprofessional of you and XYZ. I said, I want to let you know that mentioned, I'm dealing with a whole nonprofit emergency at this point. I had my
Yeah.
1-year-old in the emergency room because he decided to fall. His teeth goes up into the
Oh
gum.
my gosh.
And, that's exactly how I respond to her. I said, I do apologize. It's not the way that I operate, but I'll go ahead and take you off my do not disturb list because I don't need this energy, right? Like Maley, we create what the energy looks like. I don't need that. I don't need to have these conversations if I don't want to. This is not a job for me. It's truly out of a passion. So I appreciate everything that you shared with. Truly a great leader. I really want to see the photo of the dunk tank though. Where can we find that at? I'm just joking. Just joking.
I think it's going to be posted on social, but it's not up yet.
Okay, okay. So if you guys want to see that, you guys want to make sure you guys go to social, right? I connect. I think it's when we talk about really doing the bare minimum, just a follow, just to like, just to share, let people know that Live Well does exist.
Yep.
It's an organization that's obviously beyond their years, that are doing amazing things in the Connecticut world, but also trying to expand globally. So make sure all we got to do, listen, just share. You don't got to donate. If you do want to volunteer, I'm pretty sure, Maley, what are some
Yes.
volunteer opportunities that they may find at Live Well?
Oh my gosh, we have a wonderful volunteer coordinator that would love to connect with folks. We have people who volunteer in our Dementia Positive Cafe. We have people who help co-facilitate classes. We have people who share their gifts of music and art. So if you have a passion, people probably want to learn about it. And so if you want to have a creative outlet, LiveWell can definitely be that place for you to volunteer.
And people think that they have to, volunteer a lot of time. What's the minimum amount of time somebody can volunteer?
Oh, you could come do one special event for us for a half an hour, 45 minutes.
That's it. That's all it takes, guys. If you want to make a difference, make sure you guys show up. So I give you the blind question that the last leader has asked us. Are you ready?
I am ready.
All right. So what are the values that you live by every day to make sure Live Well continues to succeed?
What are my core values? I think that when I think of my values, I think of leading with honesty, openness, and like a tenacious drive to keep trying. Because I think that if we share when we don't know something, and if we share when we're excited about something, that's how we're going to connect as people, and that's when really cool things can come out of it. If we don't have trust in one another, then we're on a shaky foundation, and we're not going to be able to achieve the amazing mission and vision that we have as a nonprofit, as a business, as providers in human development type work.
I love it. What is your blind question to next, Lee, before I ask you my last question?
Great. So my blind question for a leader is, what is something you are continually learning and relearning about yourself and your leadership?
That's actually a really good question. I never heard that question. That is a really good question. My last question before I let you go is, if you had to name your podcast, what would it be?
Oh boy. Oh, wow, that might be the one that stumps me. If I had to name my podcast, you know what? It would probably be a pun on my last name. I love puns. And so maybe something like On the Hunt. And
Okay.
we would be on the hunt for great ideas and great
I love it.
change.
I'm only trying to speak into existence. So one day that you do got a podcast, just remember that I was a part of the journey. Even if Live Well starts a podcast, you got to be the host of it. All right.
We're
Maybe you're
building a little
interviewing.
sound studio, so maybe.
I'm saying interview some of the guests that you guys have, maybe those that are part of Live Well, using your services. I think it's great to just kind of get the word out, right? When we talk about what is happening, what better way to get people that are actually involved, whether it's your volunteers, whether it's those patients that still can have the conversations, that are living with dementia, what is their families, to get those words out there.
Yeah.
I only want Maley to be the host. You were amazing today. Thank you so much for your time.
Thank
And
you.
guys, if you guys are watching, all you got to do, it's free. Like, share, subscribe. Go visit LiveWell CT. Is it livewellct.com or is it just livewell.com?
Livewell.org.
.org, yeah, of course, I knew that. Livewell.org. However, on social is LiveWell CT,
Yes.
Facebook, and Instagram. And make sure you guys also connect with Maley Hunt on LinkedIn. Guys, it's been a pleasure to have another great leader in here just sharing insights of what it looks like in the world of helping others. Maley, we thank you. My name's Efrain. Maley, we'll catch you on the next one. Latest.